No shortage of voices in Augusta today in the debate over a bill involving both abortion and gender-affirming care. Supporters say it's about protecting patients and providers who are performing care that is already legal.
But those who oppose the legislation say it will attract out-of-staters seeking procedures that some are squarely against. News Center Maine's David Guildford reports from Augusta.
So if they make the wrong decision.
The Maine legislature is again debating abortion care and gender-affirming care. LD 227 is sponsored by Democratic Representative Ann Perry. Simply put, it would prohibit people from interfering with legal reproductive and gender-affirming care in Maine. It would also legally protect medical providers and prohibit the state from cooperating with lawsuits filed against providers for performing such care. And in the case of lawsuits, it would conceal medical records of providers and patients involved.
So it's crucially important that we attempt to shield our providers from these out-of-state actors who are really just extremists.
The bill is a response to at least 20 states that have outlawed gender-affirming care for trans youth. 11 states and D.C. have passed so-called shield laws, similar to 227.
LD 227 is the most disgusting and vile bill ever seen before in the Maine legislature.
Republicans pushed back hard on Tuesday.
Effectively kidnapping a minor.
Here comes LD 227, ready to make these medical atrocities a legal right.
Is extreme in its assault on family values, it sanctions kidnapping, and shields doctors from any consequences.
The bill does not loosen kidnapping laws. Those speaking against it Tuesday were largely concerned with people, especially minors, traveling to Maine for medical services they are diametrically opposed to. And there was no shortage of voices on either side. That afternoon, the Health Coverage, Insurance, and Financial Services Committee opened to public testimony on the bill, and a sizable crowd showed up.
We do not want to be known as a state or a nation that encourages abortion and the mutilation of children.
The doctors and the patients need to know that they can seek medical care without fear of prosecution and criminalization.
Security opened at least 2 overflow rooms for visitors to tune in, with debate stretching for hours. In Augusta, David Guildford, News Center, Maine.